Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, I will talk about the vessels of the lower limb. This is the abdominal aorta. It terminates by dividing into right common iliac and left common iliac arteries. Each common iliac artery bifurcates into the internal iliac artery, which is the artery of the pelvis, buttock, and medial thigh, and external iliac artery, which is the artery of the lower limb. The external iliac artery courses below the inguinal ligament at the mid-inguinal point, enter the thigh as a femoral artery. The femoral artery passes superficial in its upper half in the femoral triangle and passes deep in its lower half in the subsartorial canal. This is the removed sartorius muscle. The femoral artery terminates nearly at the junction of the upper two-thirds and lower third of the thigh by passing into the adductor hiatus, which is an opening in the adductor magnus muscle, to appear in the popliteal fossa at the back of the knee as a popliteal artery. This is the popliteal artery. The popliteal artery again terminates by giving genicular branches to the knee joint and two terminal branches, anterior and posterior tibial arteries, to the anterior and posterior aspects of the leg and foot. The femoral artery gives off three superficial and three deep branches. The superficial branches include the superficial epigastric artery, passes upward, superficial external iliac artery, passes laterally, and superficial external pudendal passes medially. The deep branches include one important branch which is called the deep artery of the thigh, or the profunda femoris artery, and the deep external pudendal artery. This is the deep external pudendal artery, and the last branch is the descending genicular artery. Now the arterial supply of the leg and foot. The popliteal artery terminates at the distal border of popliteus muscle by giving the anterior and posterior tibial arteries. The anterior tibial artery passes through an aperture in the upper part of the interosseous membrane and descends anteriorly to supply the anterior compartment of the leg and the dorsum of the foot. The posterior tibial artery passes along the posterior compartment of the leg and terminates at a point midway between the medial malleolus and the calcaneal tuberosity by dividing into medial and lateral plantar arteries. Both plantar arteries carry the supply of the sole of the foot. Also, the lateral plantar artery curves to the medial side, forming the arterial plantar arch that terminates by joining the terminal part of the dorsalis pedis artery. Along the course of the posterior tibial artery, it supplies the surrounding muscles and bone. It gives off two important branches. One is called the circumflex fibular branch, and the other is the fibular or peroneal artery. This fibular artery at its terminal part gives off an important perforating terminal branch that could replace the dorsalis pedis artery if it is absent, and carries the arterial supply to the dorsum of the foot. But if the dorsalis pedis artery is present, it reinforces the arterial supply of the dorsum. The anterior tibial artery, as we see, descends in the anterior compartment of the leg, and it terminates midway between the two malleoli in front of the ankle by becoming the dorsalis pedis artery. Along its course, it gives off many branches. Two branches at its beginning, which is called the anterior and posterior tibial recurrent arteries, and two branches near its termination called medial and lateral malleolar arteries, and muscular branches in between to the surrounding muscles of the anterior compartment. The dorsalis pedis artery, it passes in the dorsum of the foot, and it terminates in the sole of the foot by joining the arterial plantar arch. And it gives off medial and lateral tarsal branches at its beginning. Also, it gives off the first dorsal metatarsal artery, and it gives also an arcuate branch that gives off the second, third, and fourth metatarsal arteries. Now let's talk briefly about the veins of the lower limb. The veins draining the lower limb form superficial and deep groups. The superficial group lies superficial to the deep fascia, as we see here, but the deep group lies deep to the deep fascia. The deep veins generally follow the arteries. I mean, we have a femoral vein, obturator vein, superior and inferior gluteal veins. The major vein that drains the lower limb is the femoral vein. It becomes the external iliac vein when it passes under the inguinal ligament and then enters the abdomen. The superficial veins that are in the subcutaneous connective tissue are interconnected with the deep veins and actually drain into them. The superficial veins include two major channels, the great saphenous vein and the small or short saphenous veins. Both arise from the dorsal venous arch of the foot. The great saphenous vein originates from the medial side of the dorsal venous arch, then ascends up the medial side of the leg, knee, and thigh to join or connect the femoral vein just below the inguinal ligament. The small or short saphenous vein originates from the lateral side of the dorsal venous arch, ascends up the posterior surface of the leg, and penetrates the deep fascia posterior to the knee in the popliteal fossa to join the popliteal vein. The popliteal vein becomes the femoral vein that enters the abdomen as external iliac vein. Thank you.